Easy come, easy go, that's just how you live. Oh, take it all, but you never give. Should've known you was trouble from the first kiss. Had your eyes wide open, why were they open? Gave you all I had and you tossed it in the trash. You tossed it in the trash, you did. To give me all your love is all I ever ask. Cause what you don't understand is I'd catch a grenade for ya, throw my hand on a blade for ya, I'd jump in front of a train for ya. You know I'd do anything for ya. Oh, I would go through all this pain, take a bullet straight through my brain. Yes, I would die for you, baby, but you won't do the same. No, you won't do the same. You wouldn't do the same. Ooh, you never do the same. No.
Boy, seems intense. Hi, I'm Peter Oliver Owen, the spokesperson for Irritable Bowel Syndrome, also known as IBS.
Now, some of you may be asking, what is irritable bowel syndrome? Well, IBS is a common disorder affecting the large intestine, causing discomfort and distress.
Roughly 1 in 5 adults have symptoms of IBS, making it a very common disorder diagnosed by doctors. IBS occurs more in women than in men, and in 1 of 2 cases begins at age 35.
Now that you know what it is, how do you know when you have it?
Well, common symptoms include cramping, abdominal pain, bloating, gas, diarrhea, and constipation.
Mucus may also be present in excrement, which is a fluid that helps moisten the passages in the digestive system.
What is that?
IBS is chronic and will have to be managed long term. Even though it does not cause any harm to the intestines, does not lead to any serious diseases or cancers, and does not make changes to the body's bowel tissues. However, although some people will be able to deal with their IBS by managing stress levels in their diet, some people will have to be put on medication or go to counseling, as it can prevent them from being able to work or being able to attend social events.
Now, you're probably wondering, what causes all this to happen? Well, one theory explains that it could be the colon or the large intestine that is particularly sensitive. Other sources claim that it could be inflammation, infections, or diets, as well as the digestive system having problems, whether it's processing food too slowly or too quickly.
Certain foods can also trigger IBS. Fried foods, processed snacks, fizzy and caffeinated drinks, chocolate, and alcohol are all considered triggers.
Other symptoms include stress and anxiety, drugs such as antibiotics or antidepressants, and for women, symptoms can usually be worse during the menstrual cycle.
If you think you have IBS, your doctor will probably diagnose you on the basis of your medical history, along with a description of symptoms and a physical exam. Now, physical exams may consist of sampling of stool, x-rays and blood tests, along with a possible colonoscopy. The doctor may also diagnose IBS by looking at the symptoms, such as abdominal pain and discomfort, more specifically the kind that you've had in the last 12 months. The doctor may also judge bowel movement and frequency, as well as how much the stool consistency has changed. Doctors then judge the abdominal pain and discomfort, and if it has occurred for 12 weeks in the last year, then they will take steps to determining what the body is going through.
That step is to determine if 2 out of the 3 following effects are related to the discomfort. Discomfort is relieved by bowel movement. After abdominal pain has begun, bowel movements occur more often than usual, or the way stool looks or is formed looks different than usual. The following have been known to worsen IBS symptoms: large meals, drinks with caffeine, wheat, chocolate, dairy products and alcohol, and stress or emotional upsets.
You may also be wondering, what else can IBS be related to? Well, depression and anxiety are frequently connected to the syndrome. Also, studies have shown that people with IBS can be linked back to having childhood trauma. Also, symptoms are on a physiological platform, so although factors such as stress and anxiety do play a part, physical factors are more important to consider. IBS is a very serious problem, as for some people it can be debilitating, restricting them from performing such simple tasks as going to social activities or even traveling short distances. However, it does not cause any permanent damage to the intestine and will not result in any serious diseases such as cancer. Also, in one study, after several years, a third of the people who have had IBS no longer suffer from the symptoms. If you think you have IBS, talk to your doctor immediately for prescribed medication and tips on stress management and diet. Thank you for watching. Just remember to stay alert, stay aware, and most importantly, always, always wash your hands. Thank you. Son of a